We are on the floor at the Convention Center at the American College of Cardiology Convention here at McCormick Place in Chicago, Illinois. As I said, we are going to be discussing some of the technology with the vendors who are out here at the exhibition hall. And with me right now, Rhonda Rhine. And Rhonda is the president of CardioDynamics. CardioDynamics is a company that's involved in technology product that assists in the assessment of cardiac flow, outflow.
Yes.
And this is useful in the adjustment of medications. Is that correct?
Yes.
Tell me a little bit about your background before we talk a little bit about the company.
Yes. Well, our technology is all about selecting the correct class of drugs. So my background's very appropriate. I have a Bachelor of Pharmacy as an undergraduate and have an MBA from UCLA. So I've been able to combine both the pharmacy and the business aspects.
Okay. And why CardioDynamics? You've been with the company 13 years, you
Yes.
told me before?
Yes.
All right. So what made you decide to be involved in this kind of technology?
Well, 1 out of 2 people die from cardiovascular disease, so it's obviously a space that has a lot of need, and I found this technology probably about 13 and a half years ago, was asked to do some basic research on the potential of the technology on a potential medical marketplace, and felt that they had blood flow information in the hospital if you put a catheter into the heart, but they didn't have access to this information in the physician office place. So if we were able to develop clinical studies to show that it was of value in heart failure, shortness of breath, high blood pressure patients, and we could help physicians select the correct class of drugs versus guessing, because that's really what they were doing prior. They guessed about the hemodynamics, and so they guessed about which drugs to give. So I saw the potential if we could provide non-invasive hemodynamics, that they could then better select their drugs and take better care of their patients.
So what are we looking at right here? Is this a typical unit?
This is our premier unit. It's called the BioZ DX, and it's a platform where you have ECG or electrocardiogram with our technology, ICG or impedance cardiogram. And here is a report that physicians will get. And basically it gives you all of your hemodynamic parameters. It'll give you your parameters from the last time they saw the patient, the current time, and then it graphically displays it and will quickly let them know if the patient's in the low, normal, or high range.
What kind of physicians are likely to use this? Now, I know that we're at a cardiology conference, but I also know that this is likely to be seen in other physician offices or in hospital settings. Who else might be using this?
We sell about a third to primary care, family practice doctors, a third to internist, and about a third of our sales go to cardiologists. So really across the board. They sometimes use it for different reasons. A cardiologist may say, I really don't have trouble controlling hypertension, so your family practice, internal medicine doctors will use it more for shortness of breath, high blood pressure. Your cardiologist might use it more for heart failure because they're seeing more heart failure patients.
Thank you very much. I know that we're going to be speaking with the medical director shortly, and so I want to thank you very much for joining me. Rhonda, I certainly appreciate it. We're going to cut away to just a break, and we'll be right back.
Today, we're moving faster than ever before. Even your ideal prospect will see your ad, click to your website, then decide to read on or read none in a mere 1 to 7 seconds. After that, you become invisible. So what's the answer? How do you capture and hold the attention of your target audience? In-Time TV. The In-Time TV network broadcasts industry-specific TV shows to the people who buy your products: surgeons, primary care physicians, dentists, podiatrists, chiropractors, hospital administrators can now watch live in-time programs on widescreen, on their PC or laptop while checking email. Shows can even be viewed on a cell phone during a train commute. In-Time TV is peer-to-peer TV that covers the hot topics in industries that you sell to. In-Time TV shows are broadcast worldwide via the internet Yet the cost of running a 60-second commercial is a fraction of what you'd pay for a display ad in a trade magazine. In-time TV is what your target audience is watching.
Keeping professionals engaged worldwide.
We've just been talking about cardiodynamics. We just spoke with the president of cardiodynamics. Now we're going to speak with Dr. John Strobeck, the cardiodynamics chief medical advisor. Now, I understand that you're also a practicing physician in cardiology?
Yes, I'm a practicing cardiologist in northern New Jersey, specializing primarily in heart failure cardiology.
How did you become involved with cardiodynamics?
I've known the people from CardioDynamics since 1998 and have been a user of their device since that time, and I have become a consultant to them and have also participated in some of their clinical trials regarding the technology.
Well, let's talk about those clinical trials. What kind of trials are you involved in?
Primarily, we've been involved in using the device, which is a very useful device to diagnose the presence of fluid accumulation and also reductions in cardiac output that accompany a patient's deterioration when they have heart failure. So we've been looking at the device in clinical trials, in a randomized clinical trial, primarily to see how valuable it is to predict the deterioration of a patient with heart failure.
And the net is?
The net result is that it's very useful. That combined with a couple of other simple clinical indicators is a very strong predictor of acute decompensation in heart failure. And now we're planning a new clinical trial to show that it has value in staving off that decompensation, meaning that once an indication has been achieved and appropriate therapy instituted, that the actual deterioration can be prevented.
Can you describe the kind of technology that's involved here? I've had a chance to briefly look at the device, but in a thumbnail way, talk a little bit about the technology behind this device.
Sure. It capitalizes on the fact that the body will develop a change in internal impedance, meaning the resistance to an electrical current that's passed through it, when it has different levels of fluid accumulation in the chest cavity. So the primary determinant is an evaluation of the chest cavity fluid accumulation and also of a dynamic impedance which correlates with cardiac output.
So you're subtracting out the background fluid in the chest. Obviously, there are other fluids in the chest than in the heart. And you're ending up with the net change in fluid in the heart dynamic?
Yes. In other words, the dynamic impedance occurs on top of the static impedance, and the static impedance relates to the amount of fluid in the chest at a given moment. The dynamic impedance relates to how much blood is being pumped per beat by the heart. And those two quantities end up being very, very helpful in understanding the hemodynamics associated with a particular clinical problem and also knowing whether that patient is going in the right direction with their therapy.
What's the future of this technology?
I think the future is very bright. The future, I think, involves expansion of the technology to other clinical scenarios, such as hypertension, perhaps, and the use in evaluating other forms of shortness of breath that may or may not relate to fluid accumulation, but also to help improve the specificity of the measurement in terms of where the fluid is located, perhaps, and also to help find out if there are more sensitive indicators to deterioration than just those two.
We've taken a measurement. The measurement takes a few minutes or an hour? Or how?
It takes a few minutes, frankly.
All right.
Yes.
And we have a result. It sounds like the kind of thing where you would get a baseline measurement and then refer to in the future. Is that accurate?
Correct, yes. Usually a baseline is obtained, usually when the physician feels that the patient is clinically stable, and then appropriate measurements are made when signs or symptoms of deterioration occur or when clinical signs of fluid accumulation occur.
What happens if I walk in off the street, you've never seen me before? Is this a test that makes sense at that time?
Well, not to everybody. I mean, the people who benefit from it have to have a clinical problem.
What are the risk factors?
Oh, the risk factors for the test are none. It's really innocuous. It doesn't create any risk. It's just that it's not necessary in patients who don't have significant hypertension, for example, or who don't have a history of heart failure, or who are not complaining of some shortness of breath.
That's actually what I was asking, is what kinds of things would be a sign, oh, well, let's do this test. So
that's correct.
Okay, all right. Anything in the pipeline? Any new innovations coming along?
No, just we're focusing now on collecting the clinical trial data to validate the usefulness of the device and preventing decompensation.
What different clinical facilities are involved in this study?
Well, now there is a multi-center trial that's underway involving a whole host of both university-affiliated centers as well as practicing cardiologists in the field to evaluate the device and to try to come up with the answer that we think is there in terms of its ability to prevent problems.
Dr. Strobeck, thank you so very much for joining us.
No,
I sure appreciate it.
It's my pleasure.
I've been speaking with John Strobeck, who's the Chief Medical Advisor for CardioDynamics. And please stay with us. We'll be right back.